Dr. Osterberg, adjusting a person, chiropractic, it's a hands-on thing. You push the person, you do things, you make the person doing things. Has there any advances been made over the last decade, 2 decades? The machineries out there which aid equipment, and there are 2 types of equipment, I suppose. Not so sure, but one may be a testing and finding out equipment, a diagnostic equipment, and one is a physically doing equipment kind of thing. So anyway, has there been some advancement made? Is all the advancement good, or is some of the advancement, which is machinery, not all it is cracked up to be? Tell us about it.
That's a great question. Certainly there have been advancements in the last 20 or 30 years. I think that the biggest advancements in our profession have not so much been in equipment. The biggest advancements have been in our understanding of the body and of the healing process and what is the most appropriate treatment for patients. That being said, there are always some new things coming out on the market, and we're very skeptical. As an evidence-based practitioner, we're always looking at the latest research to see what's the new latest, greatest thing that's been well proven. But before something gets enough attention to have very expensive studies testing it and proving it, it comes out as the new latest whiz-bang gadget that doesn't have any scientific proof behind it. So there's always new things hitting the market. Very few of them actually stand the test of time. In the last few years, we've started to see cold lasers that are used with soft tissue healing. And there is some pretty good results with lasers when it comes to arthritis pain and knee pain and actually trigger point or muscle pain. So that is a therapy that we've incorporated into our practice. Of course, ultrasound has been an old standby for physical therapists and for chiropractors and those of us in physical medicine for many years. There are therapies like electric muscle stimulation. In our practice, we use 9 different kinds of electric muscle stimulation depending on what effect you're trying to get out of the tissue, and whether it's a tight muscle or whether there's swelling and inflammation and injured tissue that you're trying to treat. So certainly technology has helped out a lot. With traction has changed a lot in the last few years. Some people have tried to make traction out to be more than it actually is through this. You may have heard of decompression therapy in the last couple of years. A lot of people have been marketing that. And it turns out that the research on decompression therapy is not as great as the original marketers had claimed. However, there is still some benefit for increasing flexibility through traction. So, of course, we incorporate traction in some protocols with patients. But because of the recent research, it's never a therapy that we make as a standalone. It's not something that we would do exclusively.
Dr. Osterberg, can you perhaps move your microphone a little bit away from your beard? It looks like it's catching on and giving us a little scratching noise. Wonderful, thanks.
Got it. Is that better? Can you hear me now?
Perfect.
Okay, very good.
Continue.
I have no idea what I was talking about. Let's start this one over. I'm sorry.
You were talking about the decompression thing.
Yes, decompression therapy. A few years ago, that hit the market, and many doctors were marketing that as the greatest thing since sliced bread for back pain, and particularly for ruptured discs in the spine. However, the research on decompression therapy, which is a form of traction, has not turned out to be all that it was hyped up to be. So it is a technology that we use with some patients. It's something that we have available. It's a nice tool to have in your bag. But a great practice is never built on one tool. There is no one magic bullet that's going to help every patient. You need to understand this patient and what they do and what are the challenges that they face and help them overcome those challenges and find ways to do things in a better way so they can stop injuring themselves. And that's where we get really good results with back pain and with neck pain.
Okay. Wonderful. So there are equipments out there, but none of those equipment has yet totally, and probably as such never will, replace the real hands-on as we learned, not necessarily aligning the bones, but loosening them up again, and by doing so, permit the blood flow and the muscle flow or whatever it is, going on. So basically, yes, there's equipment out there. Just don't put on one equipment the whole thing. because it's a synergetic approach. It's a domino effect. No machine can fix all of it, and you might just simply have to work on different body parts with different things, and every so often a machine is coming along which makes a particular activity easier than what it used to be done years ago. Is that what you're saying?
Yeah, I would sum it up this way. Great doctors have the latest equipment, but just because somebody has the latest equipment doesn't make them a great doctor. It's all in how you address the patient and how you serve their needs.
I think it's the same with almost all professions. My very, very first profession was a mechanical machinery engineer. And, some of the guys, kids at the time when I was learning it and stuff, they're always asking for the newest and greatest and best tool, and they couldn't get a hole in a piece of metal with a normal, let's just say slightly older drill machine. And so they would say, oh no, I want to work on that machine over there, the brand new, blah, blah, blah. Funny enough, they couldn't get a precise hole with that machine either. And the guy who was good, he made a precise hole with no matter what machine, within reasons, I suppose. But you see what I'm saying? It's basically a great guy will then get the best out of the new machine. And I've heard it saying that if you have two people digging ditches with a bad shovel, and then you get one brand new shovel, you will always give it to the guy who was digging better with the bad shovel, because he will make the new shovel even more effective than the other guy.
I agree. Yeah,
wonderful.
Absolutely.
Thanks a lot, Dr. Osterberg.
Thank you.